This is a public service announcement. There has recently been a nationwide epidemic of the sexually transmitted disease, better known as Lymphogranuloma Venereum. LVG is most commonly known to be a problem in Africa, Southeast Asia, India, and South America. But despite it rarely occurring in the United States, it has recently made its way here. There are limited statistics on the occurrence of LVG in the U.S. This outbreak is caused by men having sex with other men. The first stage begins after about 3 days when a small skin lesion at the site of entry. It may cause the overlaying of skin to break down, but heals so quickly that it may be unnoticed. The second stage usually begins in men after 2 to 4 weeks, when the inguinal lymph nodes on one or both sides enlarging and forming large, tender, sometimes flexible masses. In women, backache or pelvic pain is common. The initial lesions may be on the cervix or upper vagina, resulting in enlargement and inflammation pelvic lymph nodes. The third stage, lesion heals with scarring, but sinus tracts can persist or reoccur. Persistent inflammation due to untreated infections obstructs the lymph vessels, causing swelling and dark skin scores. LVG is suspected in patients who have genital ulcers, swollen inguinal lymph nodes, or proctitis, and who live in, have visited, or have sexual contact with people from areas where infection is common. All sexual partners should be evaluated. After apparent success of treatment, patients should be followed for 6 months. Testing and treatment. Get a test from a medical provider if infection is suspected. LVG can be cured using medication prescribed by a medical provider. Partners should be treated at the same time. Note: a person can be reinfected after treatment. Transmission. LVG is spread by vaginal sex, oral sex, and anal sex. Prevention. Avoiding vaginal, oral, or anal sex is the best way to prevent STDs. Latex condoms, when used consistently and correctly, can reduce the risk of transmission of LVG. Always use latex condoms during vaginal and anal sex. Use a latex condom for oral sex on a penis. Use a latex barrier for oral sex on a vagina or anus. Limit the number of sex partners. Notify sex partners immediately if infected. Make sure partners are tested and treated. Management of partners. Persons who have had sexual contact with a patient who has LVG within the 60 days before onset of the patient's symptoms should be examined and tested for urethral, cervical, or rectal chlamydia infection depending on atomic site of exposure. They should be presumptively treated with a climatic regimen